Cohesion Policy After 2020, Preparing the Future of EU Investments in Health. Brussels, the 19th of February 2019. Today, Commissioners Crețu and Andriukaitis have brought together health professionals to kickstart the reflection on future EU investments in health under the 2021 to 2027 cohesion policy programs. In the context of the roundtable held today at the Commission with health associations such as European Health Management Association and EuroHealthNet, the Commissioners launched a pilot project to improve cross-border emergency services in the Pyrenees between the border regions of France, Spain and the Principality of Andorra. They also announced that health will be this year's new category for the Regio Stars Awards. Commissioner for Health and Food Safety, Vytenis Andriukaitis, said, according to the most recent Eurobarometer survey, almost 70% of Europeans want the EU to do more in the area of health. Acting via cohesion policy funds offers us the possibility to make a difference on the ground where it is needed and show that the demands expressed by fellow Europeans are not left unheard. I am also delighted that health becomes a new category for the Regio Stars. This is yet another demonstration that we must and can implement the principle health in all policies as set out in the treaty. Commissioner for Regional Policy Corina Crețu said, cohesion policy investments in health, worth over €4 billion of EU funds in the current budget, are true expressions of a Europe that protects. Healthcare is evolving and EU investments have to evolve with it. This is why we organized this discussion with health professionals, so their recommendations can serve as compass in planning EU investments in health over the next decade. Future EU investments in health. The discussion concluded that health systems are evolving towards more education, health promotion and disease prevention. They are also shifting away from hospital and institution-centered care to community-based care and towards integration of health and social care. With new policy objectives that allow for integrated investments in health, social inclusion and education, the Commission's proposal for the 2021 to 2027 cohesion policy provides the conditions to support these changes. Evolutions in healthcare require different infrastructure investments, be that in primary and community care facilities or in prevention programs, integrated care and workforce training. Cohesion policy can be instrumental in supporting these investments. Member states and regions need to design long-term investment strategies, encompassing infrastructure, human capital, innovative technologies and new care delivery models. To support these strategies, cohesion policy funds can be combined with other EU instruments, such as InvestEU, or with national programs. The Commission is ready to support member states and regions to plan these strategies. Better cross-border emergency services in the Pyrenees. Doctors in border regions cannot attend patients in need of urgent medical attention from across the border. To overcome this situation, the project When Medical Emergency Systems Erase Borders aims to ensure mutual prior recognition of doctors on both sides of the border. The second phase of the pilot project is now launched and is set to ensure bilateral agreements between the orders of doctors of the Spanish and French border regions. As a result, 15 million inhabitants of the Pyrenees will benefit from better emergency services as a result. The project is supported by the European Regional Development Fund and will be completed mid-2019. The results of this project will serve as an example to possibly replicate in other cross-border regions in the future. The Commission supports tackling obstacles linked to the governance of cross-border issues and, in its legislative proposal for Cohesion Policy 2021 to 2027, suggests setting aside 15% of any Interreg cross-border cooperation program to this purpose. Health, this year's new category for the Regio Stars Awards. Every year the Regio Stars reward the best and most innovative cohesion policy projects in Europe in 5 thematic categories, including a topic of the year. This year's edition will seek to reward quality health projects, to inspire member states and regions. The online application platform is open from today until the 9th of May 2019. An independent jury will assess the applications and crown the winners during the Regio Stars Awards ceremony, to take place in Brussels in October 2019. Background healthcare is a major preoccupation for EU citizens. A recent Eurobarometer survey revealed that healthcare was identified as the main issue facing the regions in the future, with a third of the people polled, 34%, considering it the top issue. Cohesion policy funds support projects improving access to healthcare and addressing health inequalities, reforming of healthcare systems, developing e-health and digital solutions, as well as research and innovation, health education, healthy aging, workplace health and safety. In the 2014 to 2020 programming period, €8 billion of cohesion policy funds, including a €4 billion EU co-financing, has been invested in health. 44.5 million people in the EU should benefit from improved health services over the 2014 to 2020 period.